We want to thank all of you, our fellow American friends, for the support, because PEPFAR is a contribution by the American people to the government to deal with what has been indeed a game changer in South Africa. We were burdened around the late 1990s and 2000s with the burden of HIV, TB, and other communicable diseases. And it was not about just giving us the financial support, but more importantly, it's about partnerships. Partnerships are important because science does transcend all borders. We partnered with PEPFAR to establish all these, through PEPFAR, to establish all these networks. And I've been led to believe by the experts here that through that we're able to tackle other global emergencies. Ebola, we're able to have that quick responsiveness in managing what has been this century's biggest challenge, that of COVID-19 pandemic. And through good scientific practices in South Africa, I'm proud to say that with all our institutions, and Wits being one of the key ones as well, is we're able to almost become a sentinel for some of the variants from Beta to Omicron, because through the scientific rigor and honesty in modeling and tracking, in predicting, we're able to give signals to our global partners and say, you know, we've got a new strain. I think it's something that we should take pride in, that we practice what is called scientific honesty. This program has saved millions of lives and will continue in helping us to manage some of the potential future global pandemics and other global emergencies we will have to contend with.
The PEPFAR program has gone such a long way to helping us really address HIV, but we're not there yet. We need the prevention technologies we're talking about, the long-acting cabotegravirs, and more to come. We need eventually a vaccine. We need a cure. We're not there yet. And we have large numbers, millions of people who are still living in this region and in the US who are not yet identified, are immunocompromised, and they themselves will be affected. But I think the message here is that we should also be linking our thinking about PEPFAR and global health security really strongly together. And I know that Ambassador Nkengasong is very much thinking about it, and I just want to really sort of support that, to say it's another reason why PEPFAR is so important. Humanitarian, the individual, the millions that are saved, the children that are saved. But actually, if we're serious as about global health security, we need to actually then keep our fingers on the pulse, our foot on the accelerator, whatever we want to say. We need to keep working around HIV, around TB, and also using these platforms, as you've just heard, both the PEPFAR platforms and the research platforms that we're building up in partnership with many US institutions, using them and switching them when we need to in response to pandemics.
I think we're all aware of the high burden of disease in the African region, but also that in the last few years we have seen a huge change and increase in the investments and support to the African region towards addressing some of the, of course, maybe COVID in the last 2 years, but I think that this support is extended to all other health problems. Our HIV, TB, burden, and also NCD burden has continued to be a challenge in the region, and so the support that we are receiving is a great help.